Thank you. Thank you very much. Welcome, everybody, to our 13th Coronavirus Telephone Town Hall. Maybe the most interesting that happened since our last call last week was that wonderful concert, One World concert, that was done to support the World Health Organization. Beautiful music from very fun settings as everybody spoke from or sang from their home. And I think my favorite was Jennifer Lopez singing People Who Need People, that iconic Barbra Streisand song. Well, I'm Senator Steve Glazer. We are talking about an issue today that is probably the most common question that I get out there, and that's when are we going to get through this shelter in place? What's the pathway that gives me the optimism that my life is going to get back into a good place again? And that's what we're going to be talking about. We have three terrific guests who know a lot about this issue. The first one is Aaron Alday, who is the health reporter for the San Francisco Chronicle and an expert on how the coronavirus pandemic is playing out in the Bay Area. She writes about infectious diseases, stem cells, neuroscience, and consumer health topics like fitness and nutrition. She's been on this health beat, Aaron, since 2006. You're a real veteran.
Yes. And
you started your career at the Daily Californian many years ago.
That's right.
You've come a long ways. Also in this conversation is Dr. Ori Civielli. He is the Deputy Public Health Officer for Contra Costa County and the division's Chief Medical Officer. He's on the faculty of UCSF's Medical School's Department of Family and Community Medicine and a fellow at the university's Center for Health Professions. He has been a guest on two of our previous town halls, and he's always quite helpful and informative. Our third guest is Kimmy Watkins-Tart. She is Alameda County's Public Health Director. In that position, Ms. Watkins-Tart provides overall direction and planning and leads the department's work in its pursuit of health equity in Alameda County. She has worked for many years with the local public health community in the areas of public health administration, policy development, and community health planning. Welcome to you as well to our conversation today. For those who are new to these calls, they are taped and available on the website for review. If you heard something and you want to go back and hear it again, or if you'd like to share it with friends who you think might be informed by the conversation, please do so. We are taking questions. We've already gotten a few dozen of them in, and we're going to do our best to get to them. If during the course of the conversation something strikes your fancy or you want to ask for further clarification, please send an email in, and we will do our best to answer it. Well, let me start with Aaron from the Chronicle. Aaron, Governor Newsom last week said there are 6 indicators for modifying the stay-at-home order that is in place in California. One of them, the first one, had to do with testing, being able to monitor and protect our communities through testing, contact tracing, and we're going to talk about that. But the other standards that he used in terms of the pathway forward was the ability to prevent infections in people who are at risk, the ability of our hospital and health systems to handle surges, the ability to develop therapeutics, the ability of business, school, and child care facilities to support physical distancing, which he believes is going to still be in place as there is a relaxation of the shelter-in-home, and finally, the ability to reinstate certain measures like a stay-at-home order if necessary. So that's what the governor's laid out. Number one being the ability to monitor and protect our communities through testing and contact tracing. You've written a lot of stories and done a lot of research on this issue of testing. But let's now, instead of talking about where we are today, let's at least go back another month and a half to February when the testing was organized and coordinated by the Centers for Disease Control, national agency, had a test that they thought was going to be the key to figuring out whether people were infected with COVID-19. What happened then and through the last few weeks to get us to where we are today on testing?
Right. So you're right. The initial tests all came out of the CDC. The CDC made a fateful decision early on to develop its own test instead of using tests from the World Health Organization from other countries. And, you know, that I think it's agreed upon didn't work out so well. Testing has been a disaster, kind of from the start in the United States. We introduced it very slowly. Initially, the decision was made that only people who were recently returning from China and other places would get tested. And so anybody who had symptoms or potentially, looked like they could have it, there wasn't even an option to get them tested. They did start sending out batches to the states to do testing in mid-February, but those first batches had to be resent back. It turns out there were problems with CDC labs, that those first batch of tests that went out to the states just were basically useless, so they had to start from scratch. So tests didn't really get out to the states and the counties until early March. And before then, there was, everything had to go to these labs in Atlanta. They were literally sent to Atlanta from every single state, processed in the lab there, and then returned. And it could be, a week or longer before you would get results. And it was really telling to me, covering this, that as soon as the first tests started landing in the states, we immediately started getting positive cases in the community. So, literally, Santa Clara County reported its first community case the day that they started testing their own, in their own labs in the county. And we saw that happening all over the Bay Area and all over the country, really. But even after these counties and the states got their own tests, and then we started seeing, academic institutions, UCSF, Stanford, developing their own tests, and some private, labs and manufacturers coming on board, we've still just had problem after problem with testing. We started to get more testing kits, but then we didn't have enough swabs to actually just get samples from people to do testing. We weren't having enough of the reagents, so that would be sort of the fluid that you put these samples in to be able to test them. It's just across the board, anywhere, it's almost like anywhere you could have a problem, there was a problem in getting this testing ramping up. There was these huge backlogs in the state.
So, Erin, it seems like almost the Wild West on testing. Is there anybody that's in charge? Is it a national requirement? Is it a state obligation? Is it private hospitals and health systems? Who is in charge of testing, or no one?
Well, I think that is part of the problem. It is rather scattered. In the Bay Area, the counties had to put out orders to require private labs to report how many people were being tested. So they would report positives because that was something that they were required to report, but not just how many tests were being done. So yeah, it is. Frankly, it is a little Wild West, and that's just how our healthcare system and our public health system is set up in a lot of ways. So in California, it was just even understanding how many tests were here and who was doing them and what their protocols were for doing them was just all over the place.
So I don't want to harp too much on the kind of disaster that you described to get us to where we are on testing, the slow to test, and then so many different parties testing. I do want to understand better what we know about the accuracy of tests and whether or not in this Wild West of testing, are we being sure that what's being used is really true? And a number of people have written in already that says, well, you could test me today and it says I'm not positive, but doesn't mean that tomorrow I don't catch the virus and I am. And so at what point is testing really valuable? But first, why don't you speak to the issue of accuracy? Who certifies that these tests are being done in a way that gives us accurate results?
So the tests are certified by the FDA, and there have been some accuracy issues, but I think accuracy on the whole has been not really the biggest problem here. And I think there's always going to be some of those issues that come up when you have a new product, especially something that is and should be rushed. People forget that this has been happening so fast, and there are limitations to science and technology keeping pace with that. So I think as much as we've had some accuracy issues, that hasn't really been a defining feature of this. But you are right that the bigger issue is figuring out when is the right time to test people. And it's so complicated because now we know that people are spreading this virus. They're shedding the virus is what they call it. Sometimes when they never have symptoms at all. So these are people who are infected but never get sick. They can infect others. Other people will be shedding this virus for days, 2 or 3 days before they get symptoms. So, I think that's one of the biggest complications, presumably, when we reopen, is figuring out who should be tested and at what time, at what stage. Because by the time people have symptoms, they've already been out there, presumably for days, exposing others and not even knowing it.
And that's the issue of asymptomatic individuals. And I want to ask about that, but before we get there, let's look at the facts of California. We have 30. I guess as of yesterday, we have 33,897 people who are infected with COVID-19. 33,000. Yet there have been studies now that have been done by USC and by Stanford that have tried to understand the infection rate of our society, of our state, of our region. And they have come to some different conclusions about the infection rate, that this 33,000 number may not be the right number. What have those studies said?
So I'll start this off with a major caveat, which is there have been now, since the studies came out, a lot of criticism of them. And you talk about accuracy in testing. The testing that they've been using for these population studies are antibody tests, which is different than the diagnostic tests that everybody has been talking about being problems. So these are the tests that try to look for the antibodies in people's blood to determine if they have been infected previously. And those have had some major issues with accuracy. We have a lot of those antibody tests getting out there, and a lot of them are reporting not great results, and they haven't really been necessarily validated by the FDA. So we've got a lot of that floating out. And my understanding is that those studies in Santa Clara County and in LA County, there's a lot of people saying take those with a major grain of salt. So I put that out there. I think we need to be very, very wary of these. This is all very early research. That being said, there's no doubt that we have a lot more cases out there than what we're aware of. And, these studies suggest that it's anywhere from 20 times to more than 50 times the number of cases. Other similar research has said about 10 times as much. So I think we're still figuring out. But the point is, I'm looking at our own ESSA Chronicle tracker right now, and we're reporting 35,000 cases in California, and it's very good chance it's more like, 350,000.
Let me bring in Dr. Civielli, the public health officer from Contra Costa. Doctor, we've been part of these conversations before, and you had your own thoughts many, many weeks ago about the real infection rate in Contra Costa County. Can you share your thoughts today about the issue of the infection rate and those we know about and those that we don't?
Yeah, I think when we first spoke about this, I can't even remember, 4 or 6 weeks ago, I was thinking that for every known positive, I said we probably have 5 to 10 people out there that we don't know about. And I think with the antibody studies, even though they do have some issues, I think it's become clearer that more people are out there that we don't know about. So probably for every known case, my guess is we have probably somewhere between maybe 20, 30 cases out there for every known case. So I think we in Contra Costa as of today we have 750 known cases or so, and I think we probably have in the tens of thousands actual people that have had the virus.
Okay, so the governor has laid out a path to changing our shelter-in-place order, and it now involves testing. And so let me go back to you, Aaron, and say, okay, so now why is testing going to allow us to relax those stay-at-home orders? What's the thinking there, and what do you know about it?
I think the way people have been talking to me about it, and I've been thinking about it, is shelter-in-place is essentially we have a fire, and it's like trying to douse the fire with just a giant blanket, right? Like we're just basically saying we have no control over this. It's all over the place. We need to just throw a blanket over the whole thing, squelch it, put it all out, and then we can peel it off. And what's left will be some embers that we'll need to keep track of. And the key thing is to be able to identify those embers, which say, individual cases that come up here and there, and very quickly test them, diagnose them, get them in isolation, and then identify anybody they may have come in contact with who could also be infected and put those people in quarantine. And if you can do that, if you have the testing capacity to very quickly, identify those people, then yes, if we may have to wait until people are symptomatic. I don't think we're ever going to be at a place where we can test every single person at all times to know if they're infected at any given time. But if we can quickly get on people once they've developed symptoms, even with there being an asymptomatic population out there, the thinking is that will be enough to keep this at levels that we can keep some control. So we're not going to put this thing out entirely. I think the thinking is that we're always going to have some cases that come up, but we want to keep them from exploding in nursing homes. We want to keep them at such a low level that they're not taking over our hospitals, that we can, take care of these individuals as needed and keep the rest of the population safe, and ideally keep it to such a level that we don't have to do this blanket effect and put every single person back in shelter in place again.
I want to ask you about the tracing component, but let me stay at the testing element for just a second and come back to this issue of asymptomatic individuals. In other words, they have the virus, but they're not showing any symptoms. There have been a variety of studies about what proportion of people with COVID-19 are asymptomatic, and I've seen numbers from 25 to 50%. So first, I'd love to get your reaction to what people say about those studies, and secondly, I'd like to understand better, and we may go to our health officers for this. If you have that many people with no symptoms, they're not going to know to get a test. And unless we're talking about testing in the tens of millions in our country, you're never going to get to those people to know that they have the virus and they can be spreading that virus in their daily life and whatever that may entail. But what are people saying about the studies that say 25 to 50% asymptomatic, and what does that do to it, to the reality of what a test will mean?
So the studies that have come out so far, and there is that broad range. It's 25 to 50. I've even heard higher than that as far as the percentage. I mean, we just don't know. Those studies are, for obvious reasons, really hard to do until you test, a huge population of people for active infection. It's going to be really hard to determine that, and also determine how infectious those people are. So, are they just as likely to spread the virus as somebody who is actively ill? Is something that factors into all of this. They can spread it, we know, but can they spread it that well? Maybe it's fine for them to be going out and about with a mask on, and that's good enough for mostly protecting us. But as far as what role that plays in kind of testing and contact tracing, I think it goes back to what I was saying, which my impression is the hope is that by going after that sort of low-hanging fruit, which is to say the people who have symptoms, and doing really hardcore contact tracing on them, and then having the rest of us keep practicing some social distancing. So keeping that 6 feet separation as much as possible, avoiding large gatherings, wearing masks out in public, all of that kind of stuff. Whatever we can do to maintain that distance while we return to some sort of normal will help stop, a lot of that asymptomatic spread while we then hone in on these people who are actively ill, and probably do much more testing again in vulnerable environments. So in our assisted living facilities, in jails, in shelters, in places where people are in closely living together. So I think that we'll see variations in testing depending on the community.
Okay, so testing is one thing, and you've identified ways in which tests can be helpful, particularly in vulnerable communities, nursing homes, homeless shelters, and the rest. But now the idea that they have, or at least the practice that has been used with other viruses going back decades, is if someone has it, then you have to find out who's been exposed to it so that you can try to manage it and not have it spread further, right? That's referred to as tracing. Am I describing that right? And so what's your reporting, what has it found in terms of what's required to do that type of tracing? Is it pragmatic, and what are communities doing to prepare for that?
So in this country, it's key to say, I think, because we can talk if you want a little bit about what's happening in other countries, but in this country, it really comes down to kind of the labor force. We just need, staff. We need people who are trained to do that contact tracing work, which is super labor intensive. It's, when you identify a case, when you identify an individual who is infected, you interview that person, and we have an idea, and I don't know that off the top of my head, but these experts have an idea of what is the infectious phase of that person. So how many days back do you need to go? And you just kind of find out everywhere they've been, and they don't necessarily consider a contact anybody. Like if that person has been to a Safeway, they're not going to put an alert out to that Safeway and say anybody there has to be quarantined. They're going to be looking for the person who shares the next cubicle over. They're going to be looking for, the household contacts, spouses, anybody who what's told to me is basically spend, 10 minutes straight, within 6 feet of this person would be considered like a close contact. So, they interview, they find out who those people might be, and then they have to contact all of those people. They have to tell those people, including the original case, plus all these contacts, which we're not clear on how many contacts that will be. It could be a lot once we all leave shelter in place. All of those people would have to then be quarantined for 2 weeks, which is the period, the incubation period, and be monitored essentially daily for, how they're doing in terms of both signs of infection and their health, but also just how they're doing as far as are their needs being met. Do they have a safe space to stay? Do they have food? Do they have, everything they need to quarantine safely? And that's going to be a big component of this, because that's obviously, we've all been sheltering in place. We know how hard it is, and quarantine is an actual step up from that, and it's going to be a real challenge. But if this is going to be successful, it has to happen.
Okay, that's Erin Alday, the health reporter for the San Francisco Chronicle. Well, you've set the stage. Let's go to Ms. Watkins-Tart, who's the public health director for Alameda County. Ms. Watkins-Tart, so you've obviously been immersed in this whole issue for a long time now, and you've read the stories and you've seen the studies. Give us your perspective to start on testing in Alameda County. What do you think is going well? What do you worry about? How do you see the future?
Right. So I want to thank you for this opportunity to be speaking with your constituents. And for us, the testing, our priorities really still are those vulnerable populations, staff and residents of long-term and residential care facilities, healthcare personnel, other congregate living settings. But we're hoping that over time, testing will become more available so that we can do more community-based testing. One of the things that we're really working toward is to really leverage testing that's currently available in Alameda County and in those spots where it's actually being underutilized. And to identify those places where there are testing deserts, if you will. But testing is just a piece of the strategy over time. We really need to couple this with the really robust contact tracing that we were just discussing, as well as more comprehensive and more culturally appropriate community education and information, and as well as really good data. The data piece is huge because to really have an effort like this over a long period of time, we're going to really need the data quality to be very high, so that we can target our efforts, because it won't be the same intervention day in and day out. We will need to adjust pretty quickly, and that's only going to be informed by high quality data. And last, really supporting isolation and quarantine. I believe that Erin left off with saying, how difficult this is. And for some of us who have our own homes, we have, nice size homes maybe, and have the opportunity to work from home and have food delivered. Everyone doesn't have that situation. And so as a public health department, we're really thinking through, over the long haul, how do we support people if they test positive and they need to actually isolate, or if they are a contact and they need to be in quarantine, how will we support them in staying indoors and staying quarantined, whether that's with housing assistance, whether that's food delivery, making sure that they have their medications. And so those are the things that I'm really worried about. And I wouldn't say worried like I don't think that we can do this, but I think that it is going to really take a very deep partnership with community-based organizations, faith-based organizations, healthcare providers, academic institutions. Our whole community is going to really have to work together to pull this off. I don't worry as much about the testing itself, rather the access to testing, yes, but all those other pieces of what happens next, I think are going to be really critical.
Do you think there's been compliance with the shelter-in-place in Alameda County? Are you happy or comfortable with the level of compliance. And I ask that because, if you look at it from a regional, state, national, even though we've had a shelter in place, our numbers are still growing, and we are in day 36. So even if you take into account whether that's the 7 to 10 to 14-day incubation period of COVID-19, it means that there is still spread happening even with the shelter in place in our area. Does that worry you? Do you think there's been good compliance?
I really do think that there's been good compliance, and although our numbers have steadily increased, our spike is not looking so much like a sharp spike versus a more rounded kind of curve. And our hospital system is still in really good shape. Our census is still, normal or below normal in some cases. Our 911 system is still doing really well. Call volumes are actually still down. And so I think that people really are complying. I'm not saying that there's perfection and 100% compliance everywhere in Alameda County. But as a whole, I think that we're doing a really good job, I think, as a county, not the public health department. Although I do think that we're doing a good job. Our staff has been working really hard. But the people of this county and in our region have taken this really seriously. And I think that we're seeing the results of that. And I think we should be encouraged by the sacrifices that people have been making, because this is a big sacrifice that a lot of people are making and will continue to make.
It is an enormous sacrifice. I think we think about it every day. The economic impact, the impact of business, the impact to people who've lost their jobs. Over 3 million, I believe, unemployment claims in the last few weeks in California. It's been devastating. At the same time, at the few times that I've gone out to do essential functions, I've noticed that in the grocery store, in other places, that people are not so careful that you'd like to see. And but I want to commend the public health officers, because I think that their leadership in the Bay Area region has been extraordinary, and is really a big reason why we're seeing a crest in cases, hospitalizations, and I want to commend you and your team, both in Alameda County and in Contra Costa County. Dr. Civielli, let me bring you back in with a question. We know that there's been concern about personal protective equipment, that we don't have enough masks and gowns and booties and face masks, et cetera. And I don't know if that situation has changed in Contra Costa County. But Jerry writes in and he says, how can we improve testing when the guidelines are in place now are set to limit how much personal protective equipment, PPE, are being used, because you have to use them in these testing sites. Talk to me about, are you satisfied with the level of testing in Contra Costa, and are you worried about the availability of PPE both for our health facilities and in our testing sites?
That's a really good question. I would say, as far as being satisfied, I would say no. We'd like to see more testing. We had calls with our healthcare partners, all of the major systems in Contra Costa yesterday, and the outpatient clinics as well. And we're really trying to shift things from a place, I think a month ago, most people were told, if you're sick and you think you might have this, stay home, because we probably won't have enough tests for you, because we're saving them for the sickest people. And I think we're at a place now where there is more testing available. It's taken a long time to get there, as Aaron mentioned. But we have more swabs, we have more reagents. Some of the big systems have come online with their own lab capacity that wasn't there at the beginning. So I think the messaging now is, if you're sick, we want you tested. We really want to test all symptomatic people who have symptoms that are consistent with COVID-19. And I do think that our testing sites have enough PPE. We're working on getting more all the time with our state partners and federal partners. And for the testing sites, we have enough PPE, and I'm very hopeful that the pipeline for both testing supplies and more PPE will slowly improve over the next few weeks. So so we really want people, if they're sick now, to get tested. And we talk to our Kaiser doctors, to our John Muir doctors, to our Sutter doctors, to the county healthcare system doctors, to the community clinics and the FQHCs. And I think everyone's on the same boat that we are encouraging much more testing, because that is going to be the key. As we get ready to loosen some of the stay-at-home restrictions, enough testing and contact tracing is a super key element. If you look at the governor's plan, at the federal plans, at anybody's plan, you really have to have enough testing. So we'd like to see more. One way to see if you have enough testing is what percentage of the tests are coming back positive. And there's different analyses out there, but one way is to get, you want that number lower. You want to test so much that a low percentage is coming back positive. Right now in our county, we're at about 8%, and we'd like to see that percentage go down to about 5%, which means we're doing more tests.
So we've gotten a series of questions from listeners, and they're kind of in two different buckets. There's the bucket that says, I've done travel, I think I might have had it before, I'd like to get tested. They're not writing in saying they have symptoms that are serious that might justify a test in the old school, meaning 3 or 4 weeks ago, the standards that were set then. And then we have the bucket of people who would just like to get themselves tested, that don't have necessarily a reason. They could believe that they might be asymptomatic, for example. Two different buckets of people. Can they get tested now? Do they have to have a reason to get a test?
I would say today, as of today, you still need a reason. I think that the first step for us is to be able to test all symptomatic people, and we'd like to get there first. If you're asymptomatic, it's a really tough decision, because how often do you get tested? Maybe you picked it up yesterday or 3 days ago or a week ago. Do you test yourself every day? Do you test yourself once a week? Do you test yourself once a month? So it's really tough to develop good guidelines, especially when we haven't quite gotten to the point where we're testing all the symptomatic yet. But I can tell you, I was on a call with partners from all over the state yesterday that are talking about which asymptomatic people should we prioritize for testing. Is it healthcare workers? Is it people who are going into the hospital and are about to have a surgery? Is it women going into labor before they enter the labor and delivery ward? Is it people who are being discharged from a hospital and going into a nursing home, because we know that that's a high-risk environment? So the state and the local health departments are all thinking about this actively, but our focus right now is really to make sure that everyone with symptoms is able to get a test and able to get it quickly. And we're working on the back end also to make sure that the labs have enough capacity to give us those test results quickly, so we can start the contact tracing and case investigations. So the other question that you asked was about people who think they might have had it a month ago and want to see if they did. And that's really antibody testing. And, I think in the last couple of weeks, maybe 3 companies have been approved by the FDA for antibody testing. There's a bunch of people marketing antibody tests that are not FDA approved, and a lot of crappy tests out there is what I would say. And so the availability of those FDA approved tests is still very limited, and we're still not sure exactly what to say about it, because how accurate a positive antibody test is and what it means. Does it mean you don't have to wear a mask and you can feel secure? We're not quite ready to say that. The science isn't quite there for us to give people that reassurance. So I think we're still a few weeks away from that being ready for prime time.
And that antibody test is typically a blood test. Is that right?
Yeah, there's blood, there's finger pricks, there's even some saliva tests. I think a company's coming out, got FDA approved today to test at home. It's a home kit that you send in. But so they're all over the place. But again, the science isn't quite there. Like, I couldn't comfortably tell you, oh, your antibody test was positive. I think you don't need to worry about it. You can just let yourself go. and we don't want to do that. There's also still questions about whether someone can get the disease again, even if they've had it before. So there's still a little more science that has to happen, and that just takes a little more time before we know. So I think we'll get there, but I don't think we're quite there yet.
And the point that you're making is that you might be immune for a month after you've had the virus, or 6 months, or a year, and because we don't have that science to rely upon yet, we can't comfortably say just because you had it doesn't mean you can't get it again.
Exactly. And
Okay.
the other point is the positive predictive value of a test, which is really what that means is if the test says is positive, that means you had it. It's dependent on how much of the virus is in the community. So the more there is, the better the positive predictive value is. And we actually have been relatively successful at limiting the number of cases. So the positive predictive value of the test still is not great. It will get better over time.
So about 3 weeks ago in California, we were testing in the entire state about 2,000 people a day. It's now up to, I think, around 12,000 people a day. And the governor says he wants to get to 25,000 people a day. So we're going to watch and see whether we have the capacity, because you just said those who would like to do it but don't have a real reason, it's just not there yet. And we're going to see whether that infrastructure can be built. Now, the second half of this pathway forward is the ability to trace. And do you agree that that is a part of what you think you need to see in Contra Costa County and Alameda County to know that we are getting a handle on the spread of this virus?
Absolutely, and I'm about to answer your question, but I just want to make one quick announcement. I think this is the first place this is getting announced. Is the county does have 4 community testing sites that are starting tomorrow, and the way it's going to work is if you're symptomatic, again, this is for people with symptoms, you will call an 800 number, and I'll give that out in 1 second, and you will get a phone screening. If your symptoms are consistent, you will be given an appointment for drive-in testing. So you can drive, stay in your car, you'll roll down your window, get swabbed, and the results should be back within 3 to 5 days. And those sites will be we have one in West County in San Pablo, one in Pittsburgh, one in Martinez, and one in Concord. And the 800 number is 844-421-0804. I'll say it again. It's 844-421-0804. And that will be between 8 a.m. and 3 p.m. So that we still encourage people to go through their healthcare provider, whether it's your private doctor, your clinic, Kaiser, Sutter, John Muir, whoever you have. But if you're struggling and you're symptomatic, this can be a fallback for you, and this will be available to anyone regardless of insurance.
So if you don't have the money, so if you don't have the money to pay for it, it'll still be covered?
That's right. That's right. This is community testing put on by the Public Health Department in Contra Costa County. Now, to get to your question, I think you asked about contact tracing. Absolutely. That is such a key component of the next phase of this. We're going to be slowly trying to lift the restrictions. And as we do that, we absolutely need to be able to test more, identify cases early, and then reach out. And that's not a small task. If you think of the 750 people who are positive in Contra Costa County now, imagine that each of them has 10 of those close contacts that Aaron described earlier, people that have been in close proximity to them, less than 6 feet for more than 10 minutes. To reach those 10 people, that would be 7,500 calls. So to get there, we're working hard in the Public Health Department to build that infrastructure, which is to train basically a small army of disease investigators and management infrastructure, protocols, What do you do when someone doesn't pick up the phone? How do you get them to call back? How do you maintain people's privacy as you're making these outreach calls? And then how do you give really careful and accurate instructions for either quarantine if you're not symptomatic yet or isolation if you are symptomatic? So absolutely, we are working hard to build that capacity at the county because we do think that sometime soon, it's too early to say when. I think the soonest would be in May, but some of these restrictions will begin to lift. And we're watching our hospital capacity and our ICU capacity, our 911 calls, all of those metrics to see when the right time is.
We're talking to Dr. Ori Civielli, who is the Deputy Public Health Officer for Contra Costa County. Let me bring in Ms. Kimmy Watkins-Tart, who is the Public Health Director for Alameda County. Ms. Watkins-Tart, do you feel you have the infrastructure in place to do the tracing that's going to be required going forward?
We are building it, yes. Right now we have about 17 to 20 trained people who are doing contact tracing. And as we start looking down the road, in order for us to really have an infrastructure that is big enough for the population of Alameda County, we would have to grow that to at least 100 people. However, I really feel confident in the structures that we're putting in place now, that as we want to scale this up, we will have a firm foundation to scale upon. And so this is really something that we're focusing a lot of energy around because we know that this is going to be a big part of our future.
Let me bring in Aaron Alday from the San Francisco Chronicle. You've done a lot of reporting on this issue of tracing and tracing capacity. What does your reporting show about whether we're really set up to do the tracing that's going to be required?
Well, I think what your folks just said about them building up this army now, that is definitely the work that's happening now, that needs to happen now, and every county that I've talked to is actively engaged in that, in training this workforce. I think one thing that people don't realize with shelter in place is it's not just giving our hospitals time to sort of prepare for a surge, or if we don't get a surge, to just to make sure that surge doesn't happen. It's not just about protecting hospitals, but this time is also key for pulling together these public health resources. So the testing that you've talked about so much, but also this contact tracing, this investigator army. And I know that, San Francisco is, I think, hoping to have 150 of these investigators within the next couple of weeks. Santa Clara County is building them up. Alameda and Contra Costa County are building them up. There's estimates that we may need, we'll need thousands of people doing this work in California. And I think, as folks said, the key thing is going to be that flexibility. So being able to kind of ratchet that army up quickly if we see kind of cases starting to climb, and also being able to pull back if we're in a lull. Like if this thing happens to, say, fade away for the summer and maybe we don't need as much of that work, we can have these people in reserve, but then maybe in the fall be prepared to reel them back in if we need them. But one thing I was saying before about, and I think people are really interested in this, is other countries have done this really effectively by also incorporating technology, which helps do some of that contact tracing work as far as, instead of calling each of these people individually and maintaining, these contacts over 2 weeks and doing that kind of really intensive work. If you get technology on board, you can use people's cell phones to track where they are. You can use people's cell phones to identify who they might have come in contact with. But that stuff gets real dicey on sort of the privacy front, which in this country may not go over very well. So it may be that we have to really rely on this workforce to do this stuff when, technology would be able to do it a little bit, faster and more painless in some ways. But I don't think that that's really a trade-off that a lot of people are willing to make.
And we have a number of people who've written in on that point. But let me get to some of the questions that I've gotten. Carl writes in and says, can people begin now to trace now, like a diary? Should we give people forms to fill out so that they are anticipating the fact that there could be a trace on them or someone that they know? What would you say to Carl?
This is Kimmy. I wouldn't necessarily say that you need to keep a diary of everyone that you've come into contact with. I think that if someone that you've come into contact with tests positive or you test positive, you'll remember the people that you had a lot of contact with, particularly right now when we're all supposed to be sheltering in place and we're not supposed to be in contact with that many people, close contact outside of our home. And so, yeah, I wouldn't worry about that part. I think that we'll be able to identify the people that you have come into contact with if the need should arise.
Okay, good. Now, Bob writes in, and he asks, how soon will it be before older people shut in will be able to get testing at home? And here we are just trying to advance testing in our community, and there are people who can't get out and about. Dr. Civielli, any thoughts about testing at home? How far off are we from that?
Oh, that's a great question. You know, in Contra Costa County, we have a team that goes out to nursing homes. So if we have a case in a nursing home and we want to test other people in that nursing home, we have a team of nurses that goes out and tests in congregate facilities. We're not quite at the point where we have people going out to people's houses to test. And I don't know, I'm not sure if we'll get there. I think some health systems may get there, but that's a relatively, I think that will be a relatively late development. I think we're still weeks, if not months, away from that.
I will say, just to jump in here real quick, this is Erin. The FDA approved the first at-home kit today, actually. So I agree with him. I think it's going to be a while before these become widespread, and this one, it looks like, is just going to be for healthcare workers primarily, but eventually, but within a couple weeks, will be available to consumers to purchase, and so they would do their own swab at home and then send it in somewhere and could get results back that way.
Very good. Dan writes in with a very interesting question. He says, once a person's been contacted by a deputized health official that he or she's been in contact with a known COVID-19 infected person and that there's a 14-day quarantine being ordered, he asks, is there an appeal procedure where the contacted person can contest the alleged close contact with an affected person? Doctor, anything you can say to Dan?
I do think there is an appeals procedure. I can't tell you that I know it off of the top of my head, but I think the health officer order, and I'll try to pull it up while we're talking and maybe get back on the topic in a few minutes, but I think the health officer order may have something in there, and I think you can always contact the public health department and say, you know, and try to talk to us if you feel like there's something unjust about the situation. I don't think we would grant an appeal just based on people not wanting to be in quarantine, because again, our client is the overall community. We're trying to keep the cases down in the community. But I think if there was not a true contact, then that would be a good basis.
Okay, and you can share that appeal number with my office, and we'll be happy to share it with Dan. Erin, Connor asked an interesting question. He says, are there constitutional concerns surrounding the implementation of a mandatory antibody test? So he's creating a bridge here that there's something mandatory, which I know there isn't. But have you come across any issues of potentially a mandatory antibody test and any constitutional concerns with such a requirement?
I wouldn't want to weigh in on the constitutional concerns, but I will say we are so far away from that being a mandatory thing. I don't imagine it ever reaching that point, to be honest. I think it's going to take a long time to figure out, you know, the antibody test situation, to see how accurate, to get the accuracy figured out. And then it's going to take, frankly, a long time for us to understand what antibodies mean. So are they protective at all? How long are they protective for? How much protection do you get from having antibodies? Does it depend on, you know, the level of antibodies or what kind of illness you had originally? There's a lot that still needs to be worked out. So I think people are starting to have those conversations now around the ethics and constitutionality, but I think those are really interesting conversations, but they're so theoretical at this point.
Very good. Here's a question from Florraine. She asked a number of them, but one of the interesting ones is that with the relaxing of stay-at-home orders, if that were to happen, is it more likely that the seniors will be the ones that remain isolated at home? Maybe Ms. Watkins-Tart or Dr. Civielli, and I know this is theoretical, but I know the public health officers are thinking about this. How do we begin to relax but still protect everybody? And some of the original orders were focused on the elderly and those with compromised immune systems, and then it went to everyone. So it is logical to think that as the relaxation occurs, that same group may be the one that we will continue to try to protect. And does that mean that they may be the ones that continue to be isolated at home? Dr. Civielli, do you want to weigh in on that?
Yeah, I think there's a good chance of that. I can't say that I can say that for sure at this point, but I do think they're the group with the highest risk of getting seriously ill or dying if they catch the coronavirus, and I think their restrictions are likely to last the longest for their protection.
All right, let me bring in another question, maybe to Ms. Watkins-Tart. This is a provocative one from Elizabeth. She says, it makes more sense to me to isolate the at-risk community members than to force healthy people to stay home and ruin their livelihoods and futures. Can you explain why not?
That is a very good question.
Well,
go ahead. Yeah, what does she mean by at risk?
So I think the assumption that Elizabeth is making is that the care of the elderly and those who have compromised immune systems, there's too many consequences for that, and you're hurting people that are healthy and don't have the same risks. So would you say to Elizabeth, well, if we're talking about your grandmother or your grandfather, would you still feel the same way? That were they to get sick and die, that's an irreversible action. For you to lose your job or your business is a terrible circumstance, but hopefully we can help you get back on your feet and continue to live a good life and have to get through this, but at least it's not irreversible. Is that what we would say to Elizabeth?
Yeah. Well, I bring this down to, I live in a household where there are 3 generations here. My father lives with me, and he has underlying health conditions. And although, I have to, stay engaged, I'm an essential worker and that sort of thing, I have to be also very mindful that I may be able to get through this, but he might not be able to. And so it's not just about protecting him, it's also about making sure that I'm not compromising him and his well-being. And so I think if I'm understanding her question accurately, is that, theoretically, if I'm not in an at-risk group, why should I have to shelter in place? Well, I'm coming in contact with other people who are more vulnerable than I am. But also, too, we are also very concerned about people who have underlying health conditions, even if they're not older. We have very significant rates of chronic diseases in Alameda County in the area of hypertension, diabetes, congestive heart failure, and asthma. Those conditions do make it really problematic, regardless of the age of the person. And so for those reasons, it's important for all of us to really modify our actions to protect all of us. And so when I'm thinking about the vulnerable community, I'm not just thinking about just the older adult. I'm thinking about those people who also have chronic health conditions, chronic diseases, which will be problematic for them should they test positive.
And it's my understanding that there's a difference between mortality, the death rate, and the hospitalization rate. That the hospitalization rate for people under the age of 60 is equal to those over the age of 60. Now, the mortality rate is much greater, but a hospitalization rate is not a free ticket once you survive. It could be a lifelong, a life of a debilitating condition that you're left with because of COVID-19. So the view that, well, the young aren't really affected, it hasn't really been proven out in regard to the hospitalization.
No.
Wouldn't that be true?
That's what I have been seeing, and I think we're still going to be learning more about this as time goes by, that the long-term effects on the body are still unknown, but there is some evidence that there might be long-term effects for a person. So even if you don't get hospitalized, even though you survive it, you may have weakened organs and other kinds of things. And so, again, I'm not a doctor, physician, so I can't speak as elegantly about this as my colleague. But I think it's too soon to tell, but I don't think that we should assume that you get it, you recover, and everything's fine. I don't think we should base our policies on that assumption.
You're very well said. Joanne writes in, and she wants to know whether both your agencies in Alameda County and Contra Costa County are providing some data on COVID-19. She specifically asks about, are you posting the number of cases per city within the county? How many COVID-19 tests are being performed? How many active patients? How many positive patients? Are you both in your counties posting data that is accessible to the public?
Yes.
Yeah, this is Dr. Civielli, Contra Costa County. We are, and the place to go is cchealth.org, and then you'll see a link for coronavirus. You just click on that, and you can get sort of an abbreviated dashboard, or you'll see another link that says for the full dashboard. And you'll see the total number of people tested, total number of cases, total number of deaths. We even break it down by jurisdiction, so you can look at your town, see how many cases there are, and the rate for the population of your town. It breaks it down by gender. It breaks it down by number of positive tests per day, by age group. So there's a whole lot of information at cchealth.org.
And what about for Alameda County?
Yes, for Alameda County, it's acphd.org. And if you go under the situation update tab, you'll see our dashboard that has similar data as is shared in Contra Costa County. And that data is updated every day. And so whenever you're looking, you can rest assured that it is accurate as accurate as we have it.
Very good. Let me bring in Aaron Alday for this question from Mary Ann. She's asking about vaccines, and I don't know, Aaron, in your reporting whether you've covered this issue of vaccines. I saw a report yesterday that said that the last significant vaccine, I think it was for the mumps, took 4 years to create, and at least the national public health community is talking about 12 to 18 months. Have you done any reporting on the issue of vaccines, and if so, what have you found out?
I haven't done any specific reporting on that, but I will say that, the 12 to 18 months is pretty frequently stated. This is certainly, a rush job. People are really very invested in this. So, the scientists who say 12 to 18 months tend to not I guess I shouldn't say that. They tend not to overstate these things, but, the problem with science is we just don't know. I mean, they could run into unforeseen complications, and it could be that this is super complicated to do. And, we could end up with a vaccine that's not, super protective and just does sort of a so-so job. I think it's way too soon to know what we're going to end up with and on what timeline.
Okay, can't get too optimistic too quickly on that. Let me bring in Dr. Civielli to answer a question from Jesse and Dorcas. They write in that routine health care, such as non-emergency dental work, routine blood work, have been put on hold because of the current shelter in place. Are the county health officers considering guidance to modify to allow routine medical services to reopen? Dr. Civielli, do you have any insights on that?
Yeah, there has not been an order from the health officer to limit routine health care, but I think all of the health systems locally have decided to do that prophylactically, as we were very worried about a healthcare surge and overwhelming our hospital capacity. So a lot of routine stuff was getting put off. You're going to be seeing that loosen very soon. I know some hospitals are starting up elective surgeries again. I know several systems that are looking to shift some of the visits back from all telephonic or video visits to some in-person visits, because some health conditions do require a physical exam or more intimate contact. So I think you're going to be seeing that happening very soon.
Beth asked, why is there a mandatory mask order being implemented now when we're on the downward slope of the curve? Let's stay with you, Dr. Civelli, from Contra Costa County. Why masks that just became mandatory a few days ago? Why is that necessary, even though we're seeing that we're getting closer to getting off the peak?
Going down, yeah.
Yeah, going down.
Yeah, that's a really good question, and I think it confused a lot of people initially. I think there's two reasons for that. One is we didn't have a lot of data at first whether just cloth masks would be helpful or not. And there has been now some data, it's not great, but some data that they are better than nothing, you know? And then the second piece of it is it's precisely because we're looking at lifting some of the restrictions and trying to get our economic activity flowing better that the masks will be helpful. Because if you're going to be in an office, you know, trying to maintain physical distancing of 6 feet, well, everyone knows you can't do that 100% of the time. You will walk by someone. And there's where the masks might be helpful, or on public transportation, you know. So I think they will help reduce transmission to some extent. They also really serve another interesting function. When you wear a mask, it sort of reminds you not to touch your face as much. And that's a lot of how people transmit the virus to themselves. They'll touch a surface and then touch their face. So we think that it will be an important element as we open things back up again.
Very good. I'd like to bring in again our Chronicle reporter, Aaron Alday. Two closing questions here. Steve asks, he suggests that the majority of the test kits are actually sourced from China. And given their agenda, if we're going to relax our shelter in place based on tests, are we confident that they're reliable tests?
I don't think that that's true, that the majority are sourced from China. I mean, to be fair, testing hasn't been my priority beat. There's another reporter who's more focused on that, but that's not been my impression. I will say again that as far as I know, the actual accuracy of the diagnostic tests has not been a really big issue. Okay.
Good to know, and we spoke about that at the start of our conversation. David writes in, and Aaron, you may know this, he says, because we're hearing from so many sources with regard to the virus, is there one source that has the most accurate information regarding this virus and what to do and what to expect? What would you say to David, Aaron, besides reading your stories?
I was going to say, this is I mean, I guess it really depends on what data you're looking for. I don't really know how to answer that question without knowing what this person is interested in. I mean, you know, your county health department is going to have, you know, all of them are going to have the best and most up-to-date information about what's happening in your county. I mean, assuming you're in the Bay Area, and what you need to know about, you know, where to seek care, where to get testing, all that kind of stuff. I think that most of them have done a really good job of keeping the public up to date and keeping up with timely data that is useful.
Very good. Erica asked this question. You know, she talks about moving too fast to reopen, and she expresses a concern that if we do reopen physical workspaces, would she have to go? Would it be mandatory to her? I don't know the answer to that, and I don't know, Dr. Civieri, any thoughts about if you do open it up to business with physical distancing requirements, would someone be required to go back to work in that space?
You know, I think it all depends on the business and their particular policy, and it's not in the realm, you know, public health will never say to people you have to go to work. And I believe there are some state laws that have added some more sick leave depending on the size of the employer you're working for, and some more options for Family Medical Leave Act if you're having to take care of a relative or a child with coronavirus or some coronavirus-related restrictions. So I think there are more options for taking time off if things are not safe. And we're always going to be encouraging employers, even when we do lift the restrictions, to allow for telecommuting, to continue to do, group meetings via Zoom or video conferencing, whatever the platform may be. So I think we will continue to see lots of physical distancing measures, even once work goes back into session. And beyond that, I think it will be really up to the employers and the personnel and occupational health policies for that particular place of employment.
Well, thank you very much, Dr. Civielli. Thank you for your insight as always. Thank you, Ms. Watkins-Tart, for your leadership in Alameda County. We appreciate it very much. Aaron Alday, thank you for joining in the conversation today. Thank you for your wonderful in-depth reporting that you do for the Chronicle. We appreciate it very much. This issue of testing, it's beguiling because we all recognize it's important. I think many of us see it as a failure in the crisis that we're in, and that's certainly our hope that we never get caught flat-footed again going forward. But if it's the pathway out, now we have to figure out a way to do it on a much bigger scale, and not just to test, but to be able to track and trace and quarantine those who continue to be infected, so that we are in a position to reopen our economy, our communities. People can get back to work, which is, I think, all we want. But as we've heard, it is going to still take time, and even with a relaxation, it's likely that in the short term we'll still continue to require physical distancing, 6 feet. The masks help protect others from you, as it's been discussed today. A lot of the people who have COVID-19 don't know they have it. They're asymptomatic, which means they can still shed the virus or shred it. I'm trying to remember what you said, Aaron, to others.
Shed it.
And so that remains, a critical challenge going forward. But we hope the conversation today with these wonderful, insightful people helped you understand more about the road ahead. We're going to continue to track this and follow this and continue the conversation so that you can be as informed as you can. As I mentioned, this is a recorded conversation. It's available on my website now at st07.senate.ca.gov. And we do have links there to the county health departments. We've been talking to their officials today, to the Center for Disease Control, the state of California, their COVID-19 health website, which has a tremendous amount of information. I know that this crisis is affecting all of us in very profound ways, and it has not been easy. Day 36, and we have more days ahead, and I appreciate the difficult circumstance that everybody has been in. But we're here to try to inform you and help you in any way that we can. Please let my office know if there's anything that I can do to be of help to you. We're going to continue to hold these virtual town halls to provide accurate, reliable, up-to-the-minute information, and we have many more scheduled in the weeks ahead. The one on Thursday, we're talking about the impact on farmers and farm workers. We're hearing about produce being dumped and plowed under. We heard about the Safeway transfer facility that had COVID-19 infection, where a lot of the produce to a lot of the Safeways wasn't happening. So there's bottlenecks and supply chain issues that are still constraining us. And so those are the conversations I think we're hoping to have later this week. If you're interested in tuning in for that, we hope that you will join that conversation. So with that, again, thank you to our guests. Thank you to all that are listening, and I want to wish you a very good day. Goodbye.